Thanks, Cam, and thanks to all 150 of you so far that have joined us for today's webinar hosted by the Tobacco Control Legal Consortium. I know that many of you know us well already, but for those of you who don't, we are a group of attorneys in different parts of the country working on tobacco control policy issues. The consortium is a program of the Public Health Law Center based at Mitchell-Hamlin School of Law in St. Paul, Minnesota, where the consortium's activities are coordinated. Our mission is to improve health through the power of law, and we do that by providing legal technical assistance to a wide variety of partners. Our audience today is a good representation of the many individuals and organizations we assist. Much of our audience today are state and local public health professionals, but we also have research scientists, attorneys, community-based organizations, and other advocates and members of the public interested in tobacco control policy at the federal, state, and local levels listening in today. And so what exactly is the legal technical assistance that the Tobacco Control Legal Consortium provides? Well, it's these top 4 things in green here, which really amount to providing legal and policy information throughout the course of developing, implementing, enforcing, and defending tobacco control laws and policies. We don't lobby or enter into attorney-client relationships, though, and so all of our work is educational and informational in nature. We're excited today to bring you this webinar in collaboration with the Campaign for Tobacco-Free Kids and American Lung Association, a couple of our partners that we work with who do lobby. I'll introduce our speakers in just a minute, but I also want to take a moment and just let you know where we're headed. First, I'll provide some context for our discussion today, and that starts by recognizing everyone's hard work over the years to advance the tobacco control movement. Before the Family Smoking Prevention and Tobacco Control Act of 2009 that gave the FDA authority to regulate tobacco products, the bulk of tobacco control efforts were really at the state and local levels. You all have worked tirelessly to improve the health of your communities, and your collective work remains the mainstay of tobacco control. With your work and new federal authority, though, the tobacco control policy landscape now looks different, and we continue to work to understand and harmonize the efforts of all the partners working on tobacco control policy at each of the different levels. We'll spend an hour or so today talking about the federal tobacco control policy landscape to help get to that goal of harmonization. And we're glad to have Bill Lee with us today to get us started by describing the political climate. Bill is the Executive Vice President for U.S. Programs at the Campaign for Tobacco-Free Kids. He oversees federal, state, and FDA advocacy, communications, research, and youth advocacy work. For more than 15 years, Bill has worked at the intersection of policy and law at leading organizations, including AARP and American Rivers. Prior to this work, Bill was Chief of Staff in the Massachusetts Attorney General's office, where he was part of the team that brought suit against the tobacco companies. He has also worked on numerous political campaigns at the presidential, state, and city levels. After Bill, my colleague Desmond Jenson will dig deeper into the federal regulatory process and provide litigation updates with a focus mostly on the FDA, since, as many of you know, he closely monitors the activities of the FDA and other agencies and helps the public health community in identifying ways to strengthen federal tobacco regulation. He also coordinates with public health leaders, keeping them apprised of important regulatory changes and litigation impacting federal tobacco control efforts. We'll then transition to an update on the HUD Smoke-Free Public Housing Rule, and we're happy to have Erika with us to do that. Erika Sward is Assistant Vice President of National Advocacy for the American Lung Association. In that capacity, she directs advocacy strategy and activities and serves as the lead lobbyist with Congress and the administration on tobacco control, lung health policy, and other issues for the Lung Association. Erika also oversees federal advocacy outreach, including grassroots lobbying and coalition partnerships, and also provides strategic advice on state and local initiatives. Prior to joining the Lung Association in 2006, Erika was with the Campaign for Tobacco-Free Kids. She was also an analyst for Greenberg, Quinlan, Rosner Research, a political survey research firm from 1999 to 2003. Thanks for being with us today, Erika, Bill, and Desmond. I also want to introduce myself briefly. My name is Darlene, and I'll be moderating today's webinar and our Q&A at the end. I work with Desmond at the consortium to provide legal technical assistance on tobacco control policy issues. Much of my work is focused on smoke-free multi-unit housing in Minnesota, but prior to joining the Public Health Law Center, I spent some time at the FDA as a National Academies of Medicine Tobacco Regulatory Science Fellow and did local tobacco control work at the Larimer County Department of Health and Environment in Colorado. So before turning things over to Bill, I want to tee this up a bit more. Many of you may be oscillating back and forth between these mantras right now, and with the change in administration, we received a number of questions about new regulatory developments that had us also oscillating. So to keep us on that keep calm side, I think it's helpful to review some basic civics principles that help categorize some of the issues that we'll talk about and that will continue to come up, and help us organize how you might think about the impact of all of this on your work moving forward. So of course, there are 3 branches of government, and policy is made and enforced in different ways by all 3. The legislative branch and the executive branch, we got a number of questions in these 2 areas related to the Congressional Review Act and the regulatory freeze memo issued by President Trump in January, and how these actions impacted tobacco control policy. We also got questions around litigation, and it's important to also recognize that all of these pieces of action then impact federal agencies like the FDA as well as HUD and other agencies as well. Our speakers will talk a little bit more about this as well. So what I want to talk about briefly is how the Congressional Review Act and the regulatory freeze memo impacted tobacco control policy at a very sort of high level, and our speakers will go into more details about some of this as well. But from the perspective of what actually sort of what impact there was, only one FDA rule was delayed, and here's the title of that rule for you. The original effective date was February 8th, 2017. And in accordance with the regulatory freeze memo, FDA delayed the effective date of that rule to March 21st, 2017. There was a second delay in response to a petition filed by medical device companies and drug companies, and so it has now been delayed to March 19th, 2018, and there's a comment period currently open right now to accept comments about the delay of this rule. So with that brief introduction and context, I'm going to hand things over to Bill to help us begin understanding the path we're on at the federal level.
Okay, thank you, Darlene, and thank you to everyone in the audience for joining us today. Let's start with the appropriations process, which, as they say, the budget documents are policy documents. They're a very concrete way they show what an administration or alternatively Congress, where their priorities are. And we've got an interesting start to the FY18 appropriations process. But just as background, I want to go back to the FY 2017 federal appropriations process wrapped up recently, and it was a pretty good budget and appropriation process for the tobacco control generally. And that is thanks in large part to people and professionals across the country, citizens reaching out and calling their members of Congress to let them know how they felt and how these different budget provisions or riders would have affected them. There were 2 riders that we were especially watching in the FY17 debate. The first was the grandfather date, which is shorthand for the rider that was proposed that would change the date by which if a tobacco product was on the market, if it was on the market by the certain date, I believe the date in the regulations was the date that August 2016, and this rider would have moved it back to 2007. So the effect of the rider would have been to allow all the tobacco products that were under the deeming rule to have stayed on the market. So essentially, I think we are up to about 7,000 different flavored e-cigarette products now, and there are several hundred different cigar products. All of these, everything that was on the market as of this past August would have been allowed to stay on the market while the FDA set either product standards or reviewed them individually. And this is most problematic because essentially those products, all those products that are out there that really were not in existence, especially e-cigarettes, which really weren't in wide availability back in 2007, all those products would become the new standard. In a worst case scenario, the manufacturers would be able to use those products that are on the market and now considered the standard to do, for instance, they'd be allowed to compare their products to those in terms of a new product, whether or not a new product should be allowed. The second rider that we were watching and lobbying against fairly intently is the cigar exemption. Under the language, it would exempt premium cigars, is how the industry referred to it. But then in the fine print, as they say, they defined cigars in such a way that it created a fairly large loophole that a lot of small, the small, cheap, flavored cigars could have gotten through. There's as many of you know, there are different levels of debate in the community about large premium, truly premium cigars, smaller cigars, cigarettes, etc. But this, despite the name of the cigar, the premium cigar exemption, it would have allowed the machine-made cheap cigars, flavored cigars that appeal to so many young people to continue to have been exempt completely from the deeming rule. Both riders were still in play right up until the last minute, and in the final weekend, luckily, I think because of greater dynamics, frankly, they were not in the final bill, which is great news for the tobacco control community. And I think the dynamic that we benefited from was that there were a number of riders, a number of policy riders, not specific budget line items, but policy riders that were being debated at the end with the leadership of the House and the Senate. But this handful, when it's probably about less than 20, raised such difficult problems for so many different people, different members across the spectrum, that in order to move forward, the Republican leadership, I think, made the call that rather than take the time to battle out on all these different riders, they were going to do essentially a clean continuing resolution and defer these policy questions to the next appropriation or to other legislation. So we got a clean CR without any riders, specifically without the two that we were worried about. On the budget side, as opposed to the rider side, on the budget side, we were very focused on the Office of Smoking and Health in CDC and what their budget would be. The House of Representatives cut the OSHA's budget by more than half. They cut it from $210 million to $100 million a year. The Senate held the budget for OSH steady at the $210 million level, and in the end, OSH's budget was just cut by $5 million, which, while $5 million is a lot of money even here in Washington, considering what was on the table and what the community, I think, tobacco control community was facing all in all, that was a pretty good outcome. And now, of course, as soon as the FY17 appropriations process finished, we rolled right into the FY18 process. And actually, we're already behind. They probably should have, according to the congressional schedule, should have had hearings, should have been going on for quite a while now. We are likely facing the similar issues in this budget, or in this appropriations process, including the two riders that we faced before, the grandfather date and the cigar exemption, but also potentially other riders, depending upon, you know, what the tobacco industry, what their priorities are for the coming year and where they figure the politics are. One big change, though, is the OSHA's budget is facing a dramatically different dynamic right now. And that is because the administration has weighed in with a budget which zeroes out OSH and creates a block grant which allows the states to take a number of actions regarding chronic diseases, including tobacco. And while some would argue that this is good for government efficiency, et cetera, it gives more states flexibility, et cetera, theoretically that works, but at the same time that they consolidated all these, the president's budget also cut the aggregate budgets of all these programs by 19%. So that's almost 1/5 of the dollars are missing. So the states are left with the difficult decision of how do we, as we want to or need to respond to different chronic diseases, what are the priorities? Another concern for us here at the Campaign for Tobacco-Free Kids is that history and experience have shown that, you know, if you're looking at, you know, use of the MSA dollars that have gone back to the states, or the passage, which states have passed tobacco taxes to bring smoking rates down, the history is that, frankly, that the states with the highest smoking rates are the states that are least likely to do tobacco prevention work. So now the states are going to be, with less dollars, going to be asked to, you know, what is your priority? And our concern is that tobacco, in some of the states that need it most, tobacco control is going to fall off the table completely. Of course, the president's budget is just, you know, step one of the budget. The House and the Senate are now holding hearings. They've started the hearings recently. They are, as I said, they're behind schedule, and I don't believe there's any way they're going to get it done by the September 30th deadline, by the beginning of the next federal fiscal year. And that the situation we'll probably see is likely a continuing resolution or an omnibus bill in December. And, you know, part of what's going into that calculus is that, you know, A, as I mentioned, they're starting late, and B, Congress has got a ton of priorities on their plate. As you all know, a healthcare bill was passed by the House and is sitting in the Senate now, being facing a lot of controversy there. Tax reform, the billion-dollar infrastructure bill the president has promised has yet to materialize, but it's a high priority for a lot of people. Building a border wall between the U.S. and Mexico, another campaign promise that the administration's base is probably very focused on, you know, has not materialized yet. These are all big-ticket items that will take a lot of time off the legislative calendar and will, I believe, push the final consideration of the appropriations bills until late in the year, probably in December. There's obviously a lot of pressure in both directions for what this budget's going to look like and what will the riders be, what policy issues are they going to try and decide through the budget. And stepping back for a second, as you all know, I'm probably stating the obvious here, but the Senate, in the Senate, they have Republicans are in control. They have a two-vote, the majority by 2 votes. But if the Democrats are faced with legislation they don't want to see, that a priority legislation that they don't want to see, they can filibuster. And so the Republicans are going to probably try and do a lot of things through the appropriations process, because while a standalone bill might be filibustered or could be blocked in other ways, a budget, shutting down the government, is a really high-stakes game that the Democrats are only going to do in the the most serious circumstances. So we, people ask all the time, well, what can we do about this? Obviously, the campaign for tobacco-free kids and our partners, including Erika's group, the American Lung Association, are up on the Hill, lobbying with ACS-CAN and American Heart Association and others, the state and regional groups. And we're facing the very well-funded and very well-armed tobacco lobby. The difference can be, do people weigh in or not? Do the congressmen and women hear from their citizens, their voters, their constituents? So, as a lot of people on this call have a view, have a strong professional view, but and may not be able to lobby as part of their jobs, but we all have rights as people apart from our jobs, and weighing in on these issues, having either via calls or meetings is the most effective way to move the dial and be heard. That's the appropriations process. I'm going to quickly turn to some of the bills that are pending, or some of the issues that we're looking at. The first is the CRA, the Congressional Review Act. Darlene already talked about this and how the one case where it's impacted the tobacco control, and Erika is going to be talking about the HUD smoke-free rule. The window is passed for congressional action through the CRA vis-a-vis the HUD rule, and I'll let Erika get into the details. A big one is the repeal of the Affordable Care Act and or passage of the American Health Care Act. As I mentioned, as everybody knows, I'm sure, the AHCA was passed by the House and is now pending in the Senate. The two issues that get packaged in with repeal of the ACA or passage of AHCA that are most important to the community, I believe, is one is the Prevention Fund. The Prevention Fund, which was created and funded under the ACA, is currently slated to be eliminated after FY18. That fund drives a lot of dollars to prevention, especially of chronic diseases, and including $100 million, I believe it's $100 million or more, that goes to OSH every year. And that money is used for, among other things, the TIPS campaign, the Tips from Former Smokers, the mass media campaign that OSH has done so successfully. By the elimination of that fund, if those dollars to OSH are eliminated after 18, then those ads and probably other critical work that OSH does, like funding state quit lines and providing advice to states or information to states, is going to go away. The impact of the other issue, coverage of tobacco cessation treatments. The ACA had a couple of different provisions that either mandated coverage of tobacco cessation treatments for those who have private insurance or those on Medicaid. But the bottom line, while the AHCA did not directly impact those provisions, as the Congressional Budget Office estimated, up to 23 million people are going to lose health insurance under AHCA in the next 10 years. And that's 23 million people who therefore have no ability to have insurance or benefits for tobacco cessation, which is, a huge loss, especially when thinking about the people, the most vulnerable populations who smoke at higher rates, who are probably have higher rates of getting their insurance through Medicaid. That is going to be a big blow to our work. I'm sure there are a lot of questions, or there may be questions, and I'm happy to deal with those at the end. I'm just going to run through some of the other bills that impact our work. First is the Cole-Bishop bill, and that's essentially the same as the grandfather. It's a grandfather date rider, but this is done as standalone legislation. It would have the same effect as the grandfather date adjustment, and as mentioned, would allow essentially the thousands of products out there, the e-cigarettes and little cigars, to remain on the market for likely years, given the FDA's resources and when they'll be able to adjudicate the different products. There's a growing list of co-sponsors, unfortunately, for the Cole-Bishop bill, including a number of Democrats. So this is high on our radar. We're keeping a close watch on it. Also keeping a close eye on the cigar bill. There are bills in both the House and Senate. They have essentially the same effect as the cigar rider that I talked about previously. This bill has even more co-sponsors, including a lot of Democrats, and we are, as I said, we're monitoring it really closely. I would say the Washington conventional wisdom, I guess I'll put it, is that neither of these bills is likely to move as a standalone bill, just because of the amount of legislative time floor time available to deal with all the issues that Congress has, because as standalone bills, they would potentially need to overcome a filibuster in the Senate, et cetera. But I'll just say this about the conventional wisdom. As you all know, the conventional wisdom was that Donald Trump could not win the Republican primaries, and the conventional wisdom was that he could never win a general election. A lot of people would have said the conventional wisdom was that the AHCA was never going to get out of the House of Representatives. So we are living in a different time, and a lot of the rules have changed. So we have to be incredibly vigilant and work the appropriations process very hard. The last piece of legislation I want to flag is the Hunter bill. Duncan Hunter from California has filed a bill which, in my view, represents what the e-cigarette industry really would like to see happen. It's not a grandfather date, and it's not just exempting one product like cigars, but it essentially abolishes FDA jurisdiction over e-cigarettes. And as far as who would do the regulation, it would be the E-Cigarette Trade Association would set all the standards for the e-liquids in those products for the time being. They would, under that bill, I believe they would gravitate over, would probably be a number of years, to a different rule-setting body, but for the next couple of years, the E-Cigarette Trade Association would set their own rules. And as we said when he filed the bill, this is putting the fox in charge of the hen house. Darlene asked me to cover quickly some of the new players, the key federal actors in the tobacco control world, and let me go through quickly. The FDA Commissioner Scott Gottlieb, he was confirmed within the last month. He's worked at FDA as a deputy commissioner before, and before that he was a senior advisor to the commissioner. He did a stint at CMS. Most recently he has been advising private companies, and one of those companies was one called Cure, which was a vaping retail franchisor. And he was on the board of directors, and he held an ownership stake in Cure. He's since resigned and has divested himself of his ownership stake. People said, ask what does this mean for FDA? Where will they go under Dr. Gottlieb? Two quotes from his confirmation process. The first is, he said, "I am not going to preside over a period of time when teenage cigarette smoking went back up in this country. As a cancer survivor and as a physician, that is not going to be my legacy in this position, and I'm committed to that." He is also, not surprisingly, by his ownership of and his work with the vaping company, he is, I believe, a proponent of harm reduction, and he said, "In areas where there's an inherent, obvious, and seemingly unavoidable risk related to certain consumer products, whether it's combustible tobacco or dangerously addictive opioid drugs, we have the opportunity to help consumers move to less risky alternatives." Where does FDA go? It's hard to say. We're right at the beginning of Dr. Gottlieb's term. I think we'll know a lot whether they head towards harm reduction or focus more on preventing kids from starting smoking based on how they work with the deeming rule, what they do regarding the deeming rule. Desmond is going to go into the deeming rule in detail in that, including how they're litigating it and how they're defending it, but that's what we're watching, is how they defend the deeming rule is going to tell us a lot about where FDA is headed for the next 4 years. Another new federal actor is Solicitor General nominee Noel Francisco. He was a partner at Jones Day, the law firm, which has been the law firm for R.J. Reynolds, one of the major law firms for R.J. Reynolds for years. Mr. Francisco himself represented R.J. Reynolds, including, in a number of cases, including the RICO lawsuit, which is still going on, that was brought against all the major cigarette companies by DOJ back more than 10 years ago. We are still arguing about the corrective statements in that case, and the tobacco industry is appealing virtually everything. And it is pretty interesting, I guess is the word I'll use for today, that one of the head litigators for the tobacco industry is now going to be probably be the Solicitor General for the United States. The confirmation vote, I just learned today, the confirmation vote for Mr. Francisco is going to be on Thursday. Others are going to impact tobacco control, but not directly at FDA or DOJ. Vice President Mike Pence. Many of us know him from when he was in the House of Representatives, and his record there was not great. Was not good at all, actually, on tobacco. He voted against the Tobacco Control Act, which gave FDA oversight over tobacco products. He voted against the increase in the tobacco tax to pay for children's health insurance. And as governor, he cut funding for the Tobacco Prevention Agency in his first week. And there's a quote down there on that slide. In an article he wrote, when he was doing a radio show before he was in Congress, he said, "Time for a quick reality check. Despite the hysteria from the political class and the media, smoking doesn't kill." And this is 1997, 40 years after the Surgeon General's report linking cigarette smoking to cancer. Another major actor in this area is going to be Health and Human Services Secretary Tom Price. And when he was in the House of Representatives, he, like Mr. Pence, had an abysmal record on tobacco issues. He also voted against the Tobacco Control Act. He voted against the 61-cent increase in the federal tobacco tax. He voted to cut FDA's funding by $392 million on the floor of the House. And he was a co-sponsor of the cigar exemption legislation. What does all this mean, in the age of Donald Trump for tobacco control? I think anybody who predicts the future in Washington right now, without a caveat that all the rules have changed in the past 6 months, is nuts. So I'm not going to do that. I am, with that caveat that everything has changed. I'm looking into limited data points that we have, real evidence that we have about our issues, tobacco control issues. And unfortunately, they are what they are. They point in a couple different directions. President Trump has made some past statements about tobacco that are good. He talked on the campaign trail about one of his proudest achievements was having, he's told his kids, don't drink, don't do drugs, and don't smoke. He actually has cut a couple of PSAs in his career on behalf of tobacco control issues. So that's a good signal. And not a bad signal. One goes the other direction in a strong way is the records of the appointees that he has made to relevant positions, the people we just talked about. The president's budget was not a good sign for the tobacco community. When you zero out the Office on Smoking and Health, it sends a pretty strong sign, as I said originally or earlier, about what are your priorities. And lastly, I'd say the delay in the deeming rule and putting off those deadlines for 3 months and not moving forward with an aggressive defense of that rule sends a really bad signal, and we'll find out more about that quickly. There hasn't been a direct attack yet, but I would just say I would leave you with the storm clouds are gathering, and there's a lot of good evidence that it's not going to be pretty. So I'm going to end there and turn it over to Desmond.
All right, thanks, Bill. We'll try to cheer things up a little bit, maybe, but we'll see. All right, so I've got a few topics to cover here, and you're going to notice fairly quickly that the unifying thread in all of this is going to be litigation. So first, I want to give you a quick update on the deeming regulation, and I'm going to attempt to answer some of the questions that we've been getting. The questions that we get most often are about vape shops and free samples. And then after that, I want to talk about some of the recent legal challenges and some other developments. I'm just going to assume that everyone on the webinar knows what the deeming regulation is. If you don't, or if you have questions about why the FDA had to issue the deeming regulation in order to regulate e-cigarettes, cigars, and other tobacco products, please visit our website. We have a few really good fact sheets that'll walk you through everything, and we also have an archived webinar that we did about a year ago featuring Mitch Zeller, who's the director of the FDA Center for Tobacco Products, and that'll walk you through everything about the rule and what it does. So many people in the tobacco control community have been wondering what will happen to vape shops once the deeming regulation is enforced. And there is a possible answer to that question. Under the Tobacco Control Act, a manufacturer is anyone who is creating a product, and that includes things like assembly and affixing labels, which in the past has often been the business practice of many vape shops. So the FDA noted in the final deeming regulation that if a vape shop is mixing liquids or assembling a device, they're manufacturing products. And if you are a manufacturer, according to the Tobacco Control Act, there's a host of regulations that you have to follow. Things like pre-market review, registration and product listing, and a variety of information disclosure to the FDA. Now, because of the potential burden of meeting those requirements, what the FDA suspects will happen is that vape shops will convert to what it calls a pure retail model. And what this means is that they'll stop mixing liquids and customizing devices, and they're only going to sell pre-packaged products from manufacturers. So that means that these retail stores will no longer be manufacturers who have to abide by the regulations that we discussed. they'll only have to comply with federal, state, and local point of sale and retail regulations. Some of you may have already seen vape shops making this shift in your communities. Some vape shops have decided to continue to be manufacturers, and their business practices haven't really changed. And then it's possible there are others that will change as we get closer to some of the enforcement deadlines that we're going to talk about in just a minute. But before we do that, I also want to talk about the prohibition on free samples, which is by far the most frequent deeming regulation-related question that we get. And I will try today to make it as simple as possible. This is from the deeming regulation. According to the FDA, you cannot smell or handle, or you can smell or handle a product, that's fine. But what you cannot do is consume a product in whole or in part, so even one puff, and you can't leave a facility with a free product. So that gave us a good start, but we got lots of questions like, what exactly is free? As in, what about coupons? What about signing up for a mailing list? What about getting a free product as a part of a raffle? What about 5-cent samples? What about 1-cent samples? And the other question we get is, what about non-nicotine liquid? Can that be given away for free? And thankfully, earlier this year, the FDA issued a new guidance document that actually gives us a pretty decent answer to both of these questions. First, discounts are allowed. And the FDA didn't discuss the precise level of discounts, and you'll see why in a minute, but it seems likely that the nominally priced samples, the 10-cent, 5-cent, 1-cent samples, are not probably prohibited. What the FDA says in its guidance about all the various business practices that people are asking about is this. If you have a transaction where nothing changes hands except a free product, that is probably prohibited. So a buy one, get one deal is fine as long as you are buying a product and receiving the free product in the same transaction. If what you get is a coupon that you can redeem later without making a purchase of a product at the time you receive the free product, that's prohibited. So the same is true of the other business practices as well. Signing up for mailing lists or a raffle. If you just get a free product without doing anything else, that's prohibited. If you get a coupon for buy one, get one, that's probably fine. What's prohibited is transactions where no money changes hands. So this is sort of the best we can do at a general rule, and obviously there could be some exceptions. And the reason the FDA is focusing on the transactions involving money, according to their guidance, is that that's normally where an ID is checked. So if you're not opening the register, it's more likely that someone could, take their free coupon or take their coupon for a free product and give that to a minor, and that minor could more easily redeem a coupon without age verification if there's no money transaction. So to reduce that risk, the FDA is prohibiting free samples where no money is changing hands. Now, the other question is, what about non-nicotine liquid? And thankfully, the FDA also gave us a hint at how to answer this question. Because of the structure of the law, and it's not worth really explaining the details in this context, but the prohibition on free samples applies to all tobacco products, including their components and parts, regardless of whether or not they're made or derived from tobacco. So the FDA noted in the deeming regulation that non-nicotine liquid can be a component or part of the tobacco product. So that means that the prohibition on free samples should apply. We're still waiting to see FDA enforcement of this particular provision, and that'll give us more guidance on how the language is being interpreted. But it seems pretty clear that the FDA's authority is there. So finally, I want to talk about litigation and enforcement delays. There were originally 8 cases that were filed challenging the deeming regulation. And before I get into too much detail on litigation here, I should say we also have a fact sheet specifically about deeming regulation litigation on our website. So if I lose you or if you want more information on that, certainly look for that as well. There were originally 6 cases. The John Middleton case was dismissed, and I can discuss why if there's questions, but we'll skip over that for now. The Right to Be Smoke-Free Coalition case was consolidated into the Nicopure Labs case, so those 2 cases are now one. The Nicopure Labs case is the only case so far that's had both sides file briefs on the merits of the case and hold oral arguments, and that happened back in October. And in that case, the public health community, including our organization, the campaign, and the Lung Association, among others, filed an amicus brief or a friend of the court brief in support of the government. And at this point, we're really just waiting for that court to issue an opinion, and that could happen at any time. So now I want to update you on the remaining 5 cases. So the Faircloth case, which you can see kind of in the middle, was filed by an individual who's a member of the West Virginia legislature. And the government in that case has asked the court to dismiss the case because Faircloth doesn't have standing to sue. That's a legal concept, and essentially the argument is that Mr. Faircloth as an individual hasn't actually been harmed by the deeming rule in a way that allows him the ability to sue the government. And we're waiting on the judge's decision in that case on that issue as well. The other plaintiffs are manufacturers of e-cigarettes and cigars, and so standing has not been raised. But let's talk about those other 4 cases and what's happened. The plaintiffs over there on the left, and as you can see in the second column, in all of these cases, the last substantive briefs were filed during the Obama administration. Since the Trump administration took office, the government has been asking the courts to extend its timeline for filing briefs, and the stated reason in those requests is that the new leadership at the Department of Health and Human Services needs to fully consider the legal issues. In some of these cases, the government has asked for several delays, and you can see that the filing deadlines are now pushed out until the fall. So it should be a fairly quiet summer on the deeming litigation front, but I want to highlight for you some of the most recent requests for delays because something else has happened. This is the actual language from the government's extension request to the court. The first paragraph, which is number 3, is what we've seen in the past. The second paragraph was new last month when the government noted that in addition to requesting a delay of the litigation for 3 months, the FDA was going to delay all upcoming enforcement deadlines by 3 months as well. A few days later, some of you may have received this email, which confirmed the delay and noted that the FDA would issue guidance, which it did shortly thereafter. So I think it's probably worth talking about what was and what was not delayed. So first, what was not delayed was some important provisions, the federal minimum age verification requirement, the free sample prohibition that we talked about, and a handful of other requirements and restrictions as well. So what was delayed? Well, other very important provisions as well, like application deadlines for pre-market review, prohibited modified risk descriptors, warning labels, and manufacturer registration. Obviously, this is not an unimportant list of policies. So these deadlines also are not too far off, and they actually kind of match up with the filing deadlines in litigation. So we will likely find out this fall if the government plans to continue deferring enforcement of the regulation and deferring the defense of the lawsuit, or if there will be a change for better or for worse. But as Bill mentioned, there's really no way to tell at this moment. Okay, that was a lot to go over. We just have a couple of things that I want to cover as well. And we'll start by talking about the future of the graphic warning rule for cigarettes. But before we dive into that, some of you might need a little bit of background because it's been a while since we talked about the graphic warning rule for cigarettes. This is hopefully not too confusing of a graphic, but what I'm trying to show you here is that there are 3 sets of events which were all sort of happening at the same time. The dark gray events relate to the passage of the Tobacco Control Act and the FDA's regulation that mandated graphic warning rules, or the graphic warning rule for cigarettes. The red events are the industry's challenge to the Tobacco Control Act. So that's the FDA's authority to enact any graphic warning rule, which the government eventually won. And then the blue is the industry's challenge to the FDA's graphic warning rule itself. So as you can see, hopefully, the FDA's authority was challenged immediately after the law was enacted. The FDA was very quick to issue a graphic warning rule by the statutory deadline of June 22nd, 2011. The industry immediately sued, and as the litigation was progressing, the government was winning on the issue of whether or not the FDA could issue a graphic warning rule at all, but losing on whether or not the graphic warning rule that was actually promulgated violated the First Amendment. And that's where things were really left off in 2013. The FDA has the authority to issue a graphic warning rule, but the particular rule that was issued back in 2011 violated the tobacco industry's First Amendment rights. So let's jump forward a few years. If you haven't heard already, several public health groups, including the Campaign and the Lung Association, have filed a lawsuit asking a court to compel the FDA to issue a new graphic warning rule for cigarettes. Since the ruling striking down the rule was upheld by an appeals court in August of 2012, there really had been no public information about the FDA's progress in issuing a new graphic warning rule. As I just mentioned, the Tobacco Control Act requires the FDA to issue a rule, and the FDA did issue that rule by the deadline of June 22nd, 2011. What you may not know is that the Administrative Procedure Act, which is a statute that governs the actions of administrative agencies like the FDA, allows members of the public to ask a court to compel an agency to act if it is unlawfully withholding or unreasonably delaying a specific action. So the plaintiffs in this case are arguing that the Tobacco Control Act requires the FDA to issue a graphic warning rule, and we currently have no graphic warning rule, and so that requirement is unfulfilled. In its most recent filing, the government has responded essentially by arguing that it's not unlawfully withholding or delaying the rule because although we haven't been seeing it, they are working on the rule. The brief actually lays out a very thorough prospective timeline, which I have drastically simplified. So as you can see, the FDA created a work group to essentially go back to the drawing board back in 2013, and that work was completed about 2 years later. In May 2015, they took their new prospective warnings to some focus groups for reactions. Those warnings will be refined by October of this year, and then the FDA will start the final qualitative and quantitative tests of its new warning statements and images. After that, it will start the rulemaking process, which it says could wrap up as soon as July of 2021. So this litigation is ongoing. There will be some more filings this month and next, and then after that, likely oral arguments, and we'll wait for the court's opinion. And of course, we will keep everyone updated on the progress of that litigation. So I want to move on to a completely different topic. On January 30th, President Trump signed an executive order that requires agencies to revoke 2 existing rules for each new rule that they establish. And the order also mandates that the cost savings of the deregulation offset any costs, any additional costs from the new regulation. Notably, the order does not require agencies to consider the economic benefits of new regulations, only the cost. There are some definite ambiguities in the order. The Office of Management and Budget has issued 2 guidance documents that don't necessarily clear up all those ambiguities. And it probably comes as no surprise to you that, like many of the President's executive actions, this one has been challenged in court. Public Citizen and several other groups are essentially arguing that the President does not have the power to put these kind of constraints on executive agencies. Now, this might seem counterintuitive as the President is in charge of the executive branch. However, almost all executive branch agencies are created by an act of Congress, and it's Congress that establishes what governs an agency's considerations as it issues new regulations. So the plaintiffs are arguing that it's a violation of the separation of powers in the Constitution for the President to instruct an agency, like the FDA, to deregulate to save economic costs when Congress has instructed the agency to regulate in order to protect individuals from potential harm, which necessarily creates some economic costs. To deregulate solely because of costs forces agencies to ignore Congress's instructions in favor of the President's. This case has generated some interest in the public health community, with an amicus curiae, again a friend of the court brief, supporting the plaintiffs filed by many public health groups, including our organization in the campaign. Several attorneys general have collectively filed a brief in support of the administration. There was also another amicus brief supporting the plaintiffs, filed by some constitutional and administrative law experts, and another just filed yesterday by the Union of Concerned Scientists. Additional briefs will be filed this month and next, and then we'll continue to give people updates as the litigation progresses. I will say that if this order stands, it could cause a lot of agencies, including the FDA, to rethink their regulatory plans for the foreseeable future, because it's unlikely that many agencies have a desire to start deregulating, which they would have to do if they intended to issue new regulations. So one last topic, not to be left out, is the latest update on the U.S. versus Philip Morris, which is the government's racketeering case against the tobacco industry. If this case is unfamiliar to you, again, I will strongly encourage you to look at the resources we have on our website, because this is an incredibly important event in the history of tobacco control. We also have an archived webinar about this case as well. So I'm not going to walk you through the history of the case, but I do want you to see the scope here on the slide. This case was filed back in 1999 when Bill Clinton was president and Janet Reno was the attorney general. A baby born when this case was filed would be graduating from high school this month. We are now in the 4th presidential administration since this case was filed, and it's still not quite over. So the government initially asked for many remedies, And unfortunately, the court ruled that many of them were not available, as remedies under the RICO statute must be focused on curtailing the tobacco industry's racketeering activities in the future. So on the right side, you can see the remedies that have been enforced, including the prohibition on the use of the term light. The industry's been providing marketing data to the government, and it was required to dissolve its third-party public relations and advocacy organizations, and then also pay the cost of the litigations that's been going on for 18 years now. But what I need to update you on is the corrective statements. And this particular remedy has been litigated perhaps more extensively than any other issue in the case. The issue has made several trips to the Court of Appeals, and earlier this year we saw what may have been the last appeal that's been delaying the implementation of the corrective statements. These are the only headlines I can find discussing the ruling. It did not make quite as big of news as I had expected. There are a couple of deadlines this summer for some final appeals of this decision, including one in July for the industry to appeal to the U.S. Supreme Court. But after that deadline lapses, the district court will issue an order that will lead to the implementation of this remedy. When that happens, the tobacco industry will be required to disseminate statements about the harmful effects of cigarettes, the addictiveness of nicotine, the lack of a health benefit from light cigarettes, the manipulation of nicotine delivery, and the effects of secondhand smoke. And these statements will be seen far and wide, as the industry will be required to place television advertisements on network television during prime time, and they're also required to buy full-page advertisements in the Sunday editions of major newspapers like the New York Times, Washington Post, Wall Street Journal, and USA Today. Cigarette inserts and company websites will also carry these messages, and it will be a major, major event in our world. So I'm going to stop there and turn things over to Erika.
Thank you so much. And can you hear me now? Okay, wonderful. Good, good, good. So as my slides, I'm going to go back to the beginning here, and I'm really honored to participate in the discussion today and to really focus in on the incredible rule that we have ahead of us that will make all public housing at the Department of Housing and Urban Development smoke-free, and to really emphasize that while smoke-free is the main goal, helping the smokers who live in public housing quit and get the help they need to quit is a really key secondary objective. And I really want to put that out there to recognize that the rule is not about forcing smokers to quit, but really about protecting everybody from the dangers of secondhand smoke. So let me do a quick bit of background on the rule, really recognizing that secondhand smoke is a significant problem for people who live in low-income housing. And you can see here on the screen a number of key statistics, but you know, the Lung Association has helped hundreds of public housing authorities go smoke-free, and it has been our overwhelming experience as the PHAs or public housing authorities have done this, that for the in virtually every situation, people want to be good neighbors. They don't want to do something that is going to hurt their neighbors or to cause problems. But not everyone realizes that smoke travels through electrical outlets, through ventilation, through windows that have been open, under doors, et cetera, and that you really can look in blood to determine who has been exposed to secondhand smoke. And so part of our efforts heretofore have really been educating residents about the dangers and the opportunities to be healthier and smoke-free. So the American Lung Association has been working with the American Academy of Pediatrics for 8 or 9 years on helping residents make and public housing authorities go smoke-free. And we just wanted to make sure that everybody was aware that we're talking about 2 million of our nation's most vulnerable Americans. There was a brand new study in preventive medicine that has just come out, and it's the first study to ever document the prevalence of cigarette smoking among public housing housing residents. And it finds that a third of all public housing residents are smokers, 33%. So we think about that compared to the overall national averages, and it's really a tremendously disproportionate disparity that we have. And as a consequence of all of this, the new CDC study also found that there are a tremendous number of health risk factors, and that people who live in public housing are at tremendous risk for smoking cause death and disease. And so we as the public health community now have an incredible opportunity to come together to help. And I want to highlight that in addition to those, to the third of public housing residents, so about 660,000 Americans, we also have 700,000 kids who are being exposed to secondhand smoke because of where they live, even if no one in their unit smokes. And that really is why it's about making these places smoke-free. There we go. So as I mentioned, the Lung Association and the American Academy of Pediatrics have been working on this for many, many years. And the very first initiative was really focused on creating a toolkit for both residents and for building management to work together to go smoke-free on a voluntary basis. And we were fortunate enough to be able to work with the CDC and HUD on this toolkit, which was rolled out a number of years ago now. And so the great news is that we have those hundreds of PHAs that have already gone smoke-free as experience to draw from. And what that really did was also help inform the proposed rule that was issued in the fall of 2015 that proposed to make all public housing smoke-free. Now, that's not subsidized housing, but it's public housing, and that would happen within 18 months from the date of the final rule, with a zone of 25 feet from doors, windows, ventilation, very similar to some of the state laws that we have, and that PHAs would be required to engage residents and to have public meetings. And so it was a very solid proposal. And a number of our organizations commented together on this, as you can see on this logo cloud. And ultimately, the final rule was issued last November. We had urged HUD to add both hookah, which had been excluded from the proposed rule, as well as e-cigarettes to the final rule. And unfortunately, while HUD did add hookah, so that is included and will be included in the smoke-free rule, e-cigarettes were not. But let me underscore that each public housing authority can, and we would argue should, adopt inclusion of e-cigarettes as they go along, in part because they need to, it makes it much easier for enforcement, and it also adds to the safety element, particularly as you have exploding products continuing. So from some of the fire safety aspects, that's a key part of it. And we did urge that all subsidized federal housing be included, but that was also not included. So what our goal is on this smoke-free rule as it gets implemented is to really hit it out of the park. And the only way we can do that is if we work together as a nationwide public housing team with the current public housing authorities and many of the folks that are already working with HUD directly on all of this. So what is the current status of the rule in the Trump administration? As you've heard from Bill and from Desmond, there's been some equivocation on some of the good rules, but so far, really good news. We are seeing very positive support from the Department of Housing and Urban Development moving forward. You can see that there's inclusion of this on their website. They have a series of resources that are available. And so let's just kind of go through this checklist. The February 3rd implementation date came and went, and the rule took effect. As Bill and Darlene mentioned, Congress did not file or pursue a Congressional Review Act, which was great. We didn't have any appropriations riders in the fiscal year 2017 funding bill, which also was not an accident, but was something that the Lung Association and the Academy of Pediatrics worked together to talk to members about. And we are seeing, as I mentioned, those implementing policy documents and resources on HUD.gov. The question that looms ahead of us, however, is that one of the executive orders that was recently was ordered this year by President Trump does have a requirement that federal agencies review all of the pending rules to reduce the regulatory burden from the federal government. And while we know that not only is the smoke-free housing rule a good public health rule to be protective of children in our nation's most vulnerable, there have been a number of studies that have shown that there's a tremendous cost savings associated with this rule as well. It takes less money to turn over a new unit that has not been smoked in. Fire insurance costs go down. There is much less risk of a fire as a consequence of having a smoke-free building. And so we know that there's some just good reasons why, from a whole host of different aspects, that this rule should go forward. So the Lung Association and the American Academy of Pediatrics have updated comments that we submitted as part of the rule, and we're inviting anyone, any organization, to sign on to the comments. You can see my email address here if you would like to receive a copy of the comments to review. I do want to, though, say that if you are government funded, either as a state or local health department, or if you are completely funded by the government, because these policies do advocate, or these comments do advocate for keeping the rule, those that are fully government funded are prohibited from signing on, just to flag that. So what can we do to win-win this and make this a double win? We know that by properly implementing smoke-free policies, we're going to be able to reduce secondhand smoke exposure, but we also know that there are a lot of there's a lot on the plates of housing authorities. We really want to urge you, as you work together, to first of all get involved with this. This is an incredible opportunity for the public health community to work with some of the people with whom our help is most needed and will be most appreciated by public housing authority residents, by staff, and by others within local and state public health departments. We know what works. I mean, this is very similar to a number of things. We know what works to do this. And so we really urge you to use existing resources. The Lung Association has made a tremendous number of resources publicly available at lung.org/smoke-free-housing. And we also really encourage you to work in coalitions. We have, you know, politics makes strange bedfellows, but I think working in coalition has made it for awesome partnerships. And we really see that we have a tremendous opportunity to work together with a whole bunch of organizations, including firefighters, with whom we don't normally work. And we know that ultimately involving empowering residents is critical. So we have a training available. There are resources in English and Spanish, and really right there waiting for you at lung.org/smoke-free-housing. So what's the other half of the win? Well, it's helping residents get the help they need to quit. And as I said, a third of public housing residents do smoke. We know what helps to work. What works to help people quit smoking is access to a comprehensive cessation benefit, including all 7 FDA medications, all 3 forms of counseling, without some of the artificial barriers that really quash the easy ability for someone to get the help they need to quit. And what we also want to just really urge you to consider in working on cessation aspects is that these smoke-free policies are about smoking. They're not about smokers. And there may be a lot, we've found that many tobacco users do decide to make a quit attempt as a property is getting ready to go smoke-free, but not everyone. everyone is ready to do that. And so we want to make sure that the resources are available for everyone to get the help when they're ready to do so, but that we're also not forcing anyone to do this. We're not forcing them to quit smoking as a condition of their housing, but they do have the opportunity to get the help they need. And so that's certainly something that we continue to counsel on. So again, what we are seeing from the Lung Association's perspective, and what we really want to encourage everyone at the state level to do, is to use the opportunity of this smoke-free rule to have this win-win, which is to make sure that not just the smokers living in public housing authorities get the help they need to quit, but that the rest of the Medicaid population can do the same. And we know that about 60% of everyone living in public housing has their insurance through Medicaid, and about 20% more are uninsured, and about 10% have coverage through private insurance, and another 10% on other. And so because almost 2/3 of residents have Medicaid and get their health coverage, by expanding cessation coverage in Medicaid, we can really not only benefit public housing residents, but also benefit all residents in the state that are enrolled in Medicaid. So the Lung Association talks about a consistent and a comprehensive benefit. And I will just say that consistency is really key, because in some states, like New York and Wisconsin and California, there are 20 or more different managed care plans that provide insurance coverage to people who have their coverage in Medicaid. And can you imagine being a provider trying to figure out whether or not a particular NRT or FDA-approved medication is covered through that particular MCO? It would really make working with a patient to prescribe what is best for him or her make it very difficult. And so what we really encourage is coalitions to work together across the board to have that consistent and comprehensive benefit, so that when a provider sees someone, even if they're on Medicaid, they know that, bam, they have access to all 7 medications and all 3 forms of counseling with minimal barriers. So this is impossible to read, and I recognize that, but the Lung Association has created an overlay of taking slides where Medicaid coverage is highlighted with the number of public housing units by state. And if you see your state on this and it is white, that means that only some of the FDA-approved medications are covered. Green means that all 7 medications are covered, but the stripes across the states and the Californias and the North Dakotas and the Ohios mean that there's access to all 3 forms of counseling plus all 7 medications. So our goal is to turn everybody into that patterned state color. And one of the ways that we are going to work to do that is that the Lung Association has announced a partnership with MD Anderson to create a more consistent and comprehensive tobacco cessation benefit with minimal barriers. And we're starting off in 7 states, which you can see here in red. These are the states that we're going to work towards most initially. And you can certainly be in touch with the American Lung Association staffer if you're in one of those red states about how you can become a part of increasing cessation coverage and making it more consistent, so that the smokers in these states, both within public housing and then outside of public housing, but who are enrolled in Medicaid, can get the help they need to quit. So I rushed through this a little bit because I've been cognizant of our time, but the Lung Association does have some additional webinars coming up on this topic that we're doing with a number of different partners. So once again, please feel free to email me if you have any questions or you'd like any more information, or if you would like to get a copy of the comments to sign on. And with that, thank you so much.
Thanks, Erika, Desmond, and Bill for some really great presentations and a lot of information that we covered pretty quickly, we know. So here is the contact information for the Public Health Law Center. We have been recording this webinar, and the slides will get posted. We've sent out the link there about where to find that on our website, and so you should find that shortly after this webinar all there for you. I know we don't have contact information for the individual speakers, but if you have questions, please reach out to us and we can get you connected to the right people. And now I want to sort of do a moderated Q&A with some of the questions that have come in. Erika, if I can start with you, since you were last to talk about the HUD rule here. Perhaps the most direct question was, may individuals sign on to the comment or just organizations?
It is just organizations. Okay. However, if you would like to email me again, you can, and you can certainly take parts of our comments and submit them under your own name if that would be of interest to you. But the deadline for submitting them is June 14th, so we don't have a lot of time.
Great. Thanks for that clarification, Erika. I also just wanted to mention that we know a number of state and local health departments and other government-funded agencies do submit comments to federal rule dockets and federal policy dockets. So if you have questions about whether your agency is able to do that and what some of the lobbying restrictions are, please feel free to reach out. Desmond has helped a lot of public health agencies understand sort of what sort of information is helpful to submit to those dockets and how you might, what type of information you might submit in a comment. Erika, one other question for you. Can you tell us any information about HUD's new secretary, Dr. Ben Carson?
Well, Dr. Carson, yes, indeed. He is a neurologist, yes, and a surgeon. And so we do know that he has really appreciated the input and the role that the Office of Healthy Homes within HHS or within HUD is playing. And the Lung Association and the American Academy of Pediatrics are hopeful to meet with him soon. But we are certainly excited that someone who understands health issues is working and leading HUD, particularly as we are working on this public health rule.
Thank you. Bill, a question for you. Some people say that the president's budget is dead on arrival at Congress. If that's the case, do we need to worry about proposed cuts to CDC's Office on Smoking and Health?
Short answer is yes, we still do. Parts of the president's budget may be disregarded by Congress, but there's no telling at this stage. And importantly, even if even if a particular provision is rejected, the fact that the president has made this priority, has identified the OSH for this cut, changes the, moves the goal line and makes it that much harder, has that much more work for us. So, for instance, if the House came back with a 50% cut, as they had last year, they could position that as a compromise. So there's, I think, a lot of work for us to be done, for us to do.
Okay, great. Thanks, Bill. I'm going to direct this to Desmond first, but Bill, if you want to chime in, that would be great. Desmond, can you talk about what the difference is between the grandfather date legislation that Bill talked about and the delays in pre-market review enforcement that you talked about?
That's a good question. So, yeah, there's a pretty big difference, actually. So the delayed enforcement dates really is just going to affect how long products remain on the market before they're required to undergo pre-market review by the FDA. So how long they can continue to be sold without federal oversight. Changing the grandfather date actually changes the universe of products that are subject to pre-market review at all. So if the grandfather date, which is currently February 15, 2007, so essentially all products that were on the market, that were commercially marketed in the United States on that date going forward are subject to pre-market review. And if you change that date from 2007 to 2016, then essentially what that does is grandfather all of the products that were introduced to the market before that. So then you know, you have very, very few cigars and e-cigarettes and other products that are subject to pre-market review at all. So that would be a much, much more drastic change than just sort of delaying the enforcement of pre-market review, which also is not great, but you have a pretty dramatic difference in results between those two changes.
Okay, great. That's helpful. And Bill or Erika, I know you're tracking this stuff too. Are there anything you want to add about that?
Yeah, I would just add that in addition to what Desmond said, it could change the universe by leaving those thousands of products on the market. A manufacturer could take a new product and say, this new product I've just created should be allowed on the market now because it's substantially equivalent to X, which is already on the market, which has been left on the market. So it makes it that much easier to bring in new products, I think.
Okay.
Yeah, that's true. Thanks, Bill.
Erika, anything you want to add about that?
No, I think they got both parts of that.
Okay, great. We also have one question about the graphic warning rule timeline, Desmond. How does the FDA's new graphic warning rule timeline compare to the previous rule?
Well, that's a good question, too. So initially, when the Tobacco Control Act was passed, as I said, there was a statutorily mandated deadline for the FDA, and it's essentially exactly 2 years. So the FDA had 2 years from when the law was passed to get a final rule into the Federal Register. And it's important to note that during that period of time, there were a variety of other statutory deadlines the agency had to meet. They were doing lots of other things in addition to working on the graphic warning rule. And also, I mean, on day one of the passage of the Tobacco Control Act, there essentially wasn't really even a Center for Tobacco Products. So while they're working on the graphic warning rule and everything else, they're also building an entire FDA center from the ground up. So that's a lot to do and still meet that 2-year deadline, which they did. Now, if you look at the timeline that's laid out in the government's latest filing in the graphic warning challenge, if you sort of give the FDA the period of time that their working group was essentially trying to figure out what the litigation meant, which ended in May 2015. If you go from May 2015 until when they think the new final rule would be in the Federal Register, that's July of 2021. So that's 6 years. So that's almost 3 times longer than their initial time to get a graphic warning rule out the door. So I'll let people come to their own conclusions on what that means.
Okay. Lastly, let's see here. Bill, you talked about storm clouds sort of gathering for the future of federal tobacco control and then mentioned a potential few small peaks of sun as it relates to President Trump. And Erika also talked about the forward progress with the HUD rule. I'm wondering if there are any other potential sort of sun rays for tobacco control that any of you want to mention, either at the federal, state, or local level that we can end on here.
Well, this is Erika, and in addition to the HUD rule, which again I think we're cautiously optimistic that everything will go forward, I do think that there are a couple of important aspects. I mean, number one, we continue to have tremendous support for tobacco control programs and policies from the Congress. And some of those are even bipartisan. And while we are fighting writers and we are dealing with bad bills, as Bill laid out, we also have just some very passionate supporters in both the House and the Senate, and that continues to give me strong encouragement as they move forward. Secondly, we know that there are people who care deeply and passionately about tobacco control that remain within the federal government, and I think it's important that we do everything we can to continue to support them and applaud them and to recognize that they're going through hell right now as they try to continue to advocate for public health, proven policies for public health in the tobacco sphere. And thirdly, I am encouraged about the great stuff that's happening at the state level. We saw that after Hawaii and California passed their Tobacco 21 laws, that Senator Schatz from Hawaii introduced his bill here in the Congress. And so I think we're going to continue to see state leadership bubbling up to the federal level. And so we may go through a dark period. We are still knowing that the work that's happening at the state level will rise up and continue to carry us forward and onward.
Great.
Yep. This bill, I'd second everything Erika just said. And on the state and local, I think there's a lot of really good stuff going on, including, taxes, tobacco taxes, smoke-free in a number of cities, especially in the South. The Tobacco 21 that Erika referenced, and even a couple of a nascent menthol regulation or menthol ban movement that is, I think, very exciting.
Great. So with that, I think what I'll do is end our webinar now and thank everyone for attending and encourage everyone to keep track of for future updates on our website. So thank you again to Bill and Erika and Desmond, and I hope everyone has a great day.